Hello, everyone, and welcome back to Youthful Medicine. I am Dr. Tahir, a board certified rheumatologist and an obesity medicine specialist. Today, we will be discussing a really important topic, which is about a hormone called parathyroid hormone. And this is usually ordered for patients who have osteoporosis, who see us for osteoporosis, and we monitor this test. And the question here is why the parathyroid hormone levels may rise during osteoporosis treatment with anti-resorptive therapies such as Prolia and denosumab. Prolia, which is also denosumab, is a generic name, and Reclast or zoledronic acid. Even when we have a patient who has normal vitamin D levels, normal calcium levels, normal comprehensive metabolic panel. Well, I know that many of my patients are concerned about this, and when they see their parathyroid high after they've been put on these medication like Prolia or Reclast during the treatment. So let's break it down and some of the main reasons this can happen. Number one is the suppression of the bone turnover. First, these medications, they work by suppressing the bone turnover, especially the activity of the cells called osteoclasts, which are responsible for bone resorption, meaning your bones is not gonna break down as much, and that's why they help with osteoporosis. So since this decrease in the release of the calcium from the bones, because now they are not breaking down as much, the body compensates by increasing the parathyroid hormone, which is a little tiny organ sitting right above the above next to the thyroid gland in our neck, and that hormone is responsible for maintenance of calcium balance. So even though your calcium levels might look normal on the lab test, your parathyroid hormone is making sure that it remains high, because now you don't have that turnover of calcium from because the breakdown of the cells is low. There's also something called calcium sensing receptor sensitivity. Next, this sensors in our calcium a metabolism called calcium sensing receptors, uh, they become more sensitive, because when the bone's resorption is suppressed, the parathyroid gland, the hormone which is responsible for maintaining calcium levels, sends out this as a signal to increase the parathyroid production to maintain calcium balance in the body. Despite that your calcium is normal, it wants to make sure that it remains normal, because for our bone metabolism and our movements of the body, like the muscle action potential, everything in our body has a balance, and the calcium plays a big role in that. There's also something called transient effects. So another factor to consider this increase in the parathyroid, it might be that it is a temporary thing and our body is just trying to respond to this new pattern of bone resorption and bone breakdown. Our bodies are physiologically programmed to lose bone after the age of 60, because that's the cycle of human life. But now, with the more and more better quality of life, patients' medical treatments are better, people are living longer and healthier lives. So, our body needs a little bit more time to adjust to this new pattern of bone resorption. So once when you first start the treatment, your body is adjusting to the new balance of the turnover and the calcium regulation. Over time, the parathyroid hormone may settle down as your system finds a new equilibrium. I have seen patients whose parathyroid hormone really jumped up initially when I started the treatment, but after 4 or 5 years of treatment, this parathyroid hormone has become normal. Another topic is that it could be associated with your levels of calcium and vitamin D absorption. So, even though with normal vitamin D levels, changes in the calcium absorption and utilizations can temporarily impact the calcium dynamics in the body, like how it moves and fluctuates in the storages. So, this can drive up the parathyroid level, leading to what we call secondary hyperparathyroidism. And I've talked to many experts in this field, and the consensus is that after the medication, if the parathyroid hormone rises, it is not a major clinical concern. Finally, there are what we call the feedback mechanisms. The body's feedback mechanism is very complex and very sensitive. Elevations in the parathyroid hormone might be the body's way of making sure that any potential dips in the calciums are covered for, even before they show up on the lab test. So our body has an amazing sensing potential, and it can sometimes take actions for something that it anticipates that might be happening. So while a rise in the parathyroid hormone on the test during the treatment can seem alarming, it is often a natural response to the way that the medications work. However, monitoring is still important. If the parathyroid hormone levels remain persistently elevated or rise higher than average response seen in our patient population, we will then work out further, such as to rule out parathyroid adenomas or parathyroid tumors and other causes of hyparathyroid. So this summarizes the topic of elevation of parathyroid during antiresorptive treatment for osteoporosis with either reclast or Prolia. Thank you so much for watching today's video. If you found this helpful, please like this video, subscribe it, and share it with a loved one. And I will continue to produce useful, reliable material related to autoimmunity, obesity, and longevity. Until next time, take care of yourself, stay youthful and healthy. Bye.